Question number 8. A nurse received the serum digoxin level result for the patient the day and notes that the result is 2.6 nanograms per milliliter. Which of following nursing actions is the most important? A. Notify the physician. B. Check previous vital signs of patient. C. Record normal value on nursing note. D. Administer scheduled dose of medication. The answer is A. Notify the physician. During CPR of an admitted patient following the cardiac arrest, 2 DC shocks and 1 dose of epinephrine was given. A third dose was delivered followed by antiarrhythmic medication. What medication is the most likely to be given next? A. Adenosine. B. Lidocaine 2 mg. C. Epinephrine 1 mg. D. Sodium bicarbonate. The answer is C. Epinephrine 1 mg. Question number 10. A nurse is preparing an order of amidramine 30 mg POBD. The available check is 15 mg 5 ml. What is the correct dosage of the medication to be administered? A. 5 milliliters. B. 10 milliliters. C. 15 milliliters. D. 20 milliliters. The answer is B. 10 milliliters. Thank you for watching. For complete study materials and other assistance, contact Nursing Mantra through WhatsApp on 9715025155717. Stay tuned for more videos.